Good morning, guys. I am again here with the subjective questions. And last video, we discussed up to the question number 7, and today we are moving ahead with question number 8. Okay, let's start. The question number 8 given here is list 3 disadvantages of infectious diseases. You have to give disadvantages. Then what are the disadvantages means limitation, right? You have to give what are the limitations. Then the limitation is that the first one is infectious diseases are the source of spread of infection. They may spread from one person to the another, right? So because these are the infectious, so a healthy person can be infected through the unhealthy one or infected one. Then the second thing is that once someone has disease, his body function are damaged and he may never recover completely, right? Sometime in most of the time he may recover, but it may also happen कि he never recover completely, right? So never recover, this is also one chance है ना कि ये भी हो सकता है. And the third thing is that this the treatment of the infectious diseases will be time taken. It will take time. It means that someone suffering from the disease is likely to be on the bed for a long time also. ठीक है, so we can say long time on bed, right? Now see the next question. It was diagnosed that patient has lost the, now it's visible, power of fighting against any infection. Okay, name the disease from which the patient is suffering from. Okay, lost the power of fighting against any infection. It means immune system is very weak. है ना, immune system is has become weakened. So the disease may be AIDS, AIDS, right? Now next is name the pathogen responsible for the disease. Then it is the HIV virus. Okay, now next question. Name 2 infectious diseases and their causes. Okay, 2 infectious, sorry, non-infectious diseases. So there are so many non-infectious diseases. You can give the name. It may be the cancer, it may be the deficiency diseases, है ना? Deficiency diseases, as you know, it may be the goiter, it may be the anemia, it may be the scurvy. And how many it is asked here, name, ठीक है, right? So these may be some of the example. And high blood pressure, heart failure, kidney failure, these and yes, these all are the diseases which may be there. Okay, then their cause, you have to give the causes also. Okay, if we are talking about the cancer, the cancer is due to the genetic abnormalities. Cancer is due to the genetic abnormalities. And if we talking about the किसके लिए that deficiency diseases, then obviously you are not taking the all the nutrients in a our diet, है ना? If you are not taking a particular nutrient for a long time in your diet, then you will suffer the disease related to that. Okay, now next maybe if it is the high blood pressure, then it may be due to the excessive weight, lack of exercise. Now next is then we are moving to the next question. Okay, name and give an example of each. The disease causing factors within the body. Okay, you have to give the factors which are already present in your body. So what may be that factor? That may be the excessive weight, and the second may be the hormonal imbalance, right? Hormonal imbalance. Hormonal imbalance. Now next question. The non-cellular disease causing microorganism. So this is non-cellular, it means this is talking about the virus. Now next is the substance introduced in the body to confer immunity against subsequent infection. Okay, then what may be that substance? That may be vaccine, है ना? This will confined, yeah, this will check the further, so that the further infection will not be there, and आपके अंदर antibodies बनी रहेंगी और infection के chances कम रहेंगे. Now next question to you, what do you mean by the disease symptoms? So symptoms are the evidences or the physical indication that points the presence of disease. Explain by giving two example, right? So these symptoms are visible from um, either in the form of the structural or functional changes in the body and its part. Okay, on the basis of these symptoms, doctor can search or search for definite clue or the sign for a particular disease. For example, symptom of the, if we talk about the malaria or typhoid are the same, like fever, weakness, headache, etc., but the sign of the disease are different. As malaria fever, this is a cyclic symptoms are there. First is chill, then after that hot stays, then sweating stays, and after some time this will repeat, the cycle will repeat. While in the typhoid fever, rashes will be on the body, stomach pain, etc., right? So these are the few examples. Now next question to you, a baby is not able to tell her or his caretaker that he or she is sick. What would help us to find out that the baby is sick? Okay, if a baby is sick, so obviously because being too much small, he is not able to tell the problem. Then the symptoms will be, number one, it may be the crying. He is continuously crying. Then obviously आपको समझ में आ जाएगा क्या कि baby is not well, something is happening, कुछ प्रॉब्लम है. Then second may be the drooping of eye. Drooping of eye मतलब eyes जो हैं वो कैसी हो जाती हैं, है ना? क्या टर्म यूज करना चाहिए, बहुत सूनी सूनी सी हो जाती हैं उसकी आंखें, छोटी हो जाती, ब्राइटनेस नहीं रहती आंखों में, है ना? Then next is the redness of eye. Eye may become red, है ना? रेडिश हो जाती है. हाई टेम्परेचर, तो ऑब्वियसली फीवर, क्या फीवर, देन हाई टेम्परेचर, drooping 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 of eye, and continuous crying. These may be the sign. The next, the sickness from which baby is suffering. अब ये कैसे पता लगाना है? Then some indication, है ना? Some symptoms will be there. क्या if lose motion and stomach pain है, तो क्या हो सकता है? क्या lose motion and stomach pain है, तो obviously it may be related to the intestine, और ये क्या हो गया, indicate कर रहा है किसको? डायरिया को. Then second may be the high fever, headache, muscular pain, shivering हो रही है, feeling very cold और sweating हो जा रही है, तो this is malaria. Redness and persistent rubbing of eye अगर कर रहा है तो it may be the eye flu, right? And if skin is pale yellow means मतलब yellow हो रही है, and urine is also yellow, then jaundice may be there. ठीक है? Then the second, the last is that कि we should go for the test, and according to test we will come to the final decision. Now next question. A worm, you have to give the name, a worm which is found in our small intestine. So in a small intestine, ascaris is found. Now next is bacteria responsible for causing cholera. Cholera is caused by a bacteria. The name of the bacteria is Vibrio cholerae. Right? Now next is baby from a poor family is suffering from loose motion. Okay. Predict the first, second, and third label causes of the disease in the given case. Okay, then what will be the first, second, and third? First may be the immediate cause. Immediate cause means a virus, a bacteria, कुछ भी है वो enter कर चुका है body में. This is the first, maybe from the contaminated drinking water, it may be from the contaminated food, या फिर छोटा बच्चा है तो अपने हाथों में ही वो टॉयज वगैरह से भी है ना गिराते हैं, मुंह पे लगाते हैं, तो उससे भी हो जाता है. Then what may be, this may be the first cause, क्या, entry of germ inside the body. Okay, and now next is a baby suffered because he is not well nourished. Getting, he is not well nourished, so that the virus from the water or any contaminated food वो आपके सिस्टम में जो है अटैक कर चुका है और वो फटाफट वहाँ ग्रो कर जाता है. This is a second level cause. Simply we can say immune system is not strong. है ना. और रीजन क्या था? इट मे बी द poor nourishment, or maybe he or she is belonging with the poor family, so they are not able to give her or to him proper nutrition, है ना, proper अच्छा खाना नहीं मिल रहा है बेबी को. This is the second level cause. And if we talk about the third level cause is public services provide poor public services, right? क्या? Poor public services. Poor public services means safe drinking water is not available, surroundings are not neat and clean. Then this is due to that the chances of the bacterial infection और इन सब के chances ज़्यादा हो गए. Clean drinking water है ही नहीं और उसमें जो है वो infected है, तो obviously then these all may be the reason. First is immediate cause, second is the immune system, and third is the surrounding, related to the surrounding, right? Poor public services. Okay, so we discussed question number 8 to 15 today, and I hope you got it. Okay, bye and have a nice day.